Welcome. My name is Brent Murphy. I'm the founder and president of RTU. Right? Why would you look at a graduate program in medical health physics from RTU? Our curriculum, it's very active, it's very dynamic. It's got a medical physics emphasis and it's got a health physics emphasis. Too many times there's been a wall put in between those two disciplines. Right? In medical physics, okay, it's kind of clinical, it's dealing with radiation oncology primarily. Could have been diagnostic, could have been nuclear medicine. Health physics, the regulations, the paperwork, right? Not really an active engagement between the two. We're going to break down those walls. We're going to show how important it is for the medical health physicists to be engaged, right? To be actively engaged. Where's this going to play the biggest role? As the regulations increase as far as the guidance and the mandatory laws that will be imposed on the different radiological sciences, right? This medical health physicist has to have an active role and work with the clinical side. So how can we help convey and break down that wall? Our faculty is clinical. They're leaders in the field, not only in medical physics, but also in radiation safety, right? Most of our instructors have been radiation safety officers for greater than 10, 15 years, right? We have the capacity. We're very clear and concise in our instruction. We can take something regulatory that may be based off of something dynamic and make it clinical, so that then that medical health physicist has an appreciation of really what's going on. What does that do? It creates teamwork. How do we deliver this? Well, it's very exciting. It's kind of a hybrid or blended approach. This dynamic delivery mechanism, right? You can attend classes at one of the regional campuses. You could do it virtually online, right? You can combine the two, right? We have boot camps with the online components. 1 or 2 weeks a semester, right? You come to one of the regional campuses and we have a boot camp. It's a review. It's new instruction. It's creating the relationship amongst your colleagues, if you will, amongst your other students, right? In this professional setting that allows us to learn and learn both sides, right? So what's the entries? Clearly you've got to have a bachelor's degree in one of the sciences. They're going to be very, very close to the same prerequisites that we have for the graduate programs in medical physics. Why? Because there's so much overlap. There's so much importance of that medical health physicist understanding what's going on in the clinic, in radiation oncology, right? In radiology, in nuclear medicine, a new emerging field called nuclear oncology, right? Introducing that. What's also exciting about the curriculum, if you will, is that medical health physicist also needs to have the background as far as reactor health physics, as far as environmental health physics. Many times when you wear any hat that has the word radiation in it, you need to know all disciplines, right? So RTU's relationships provide opportunities. It provides growth within your profession, possible employment, right? The past 10 years, advanced radiotherapy consulting, right, education and training have trained over 2,000 professionals in the radiological sciences. This is very exciting. We take all those lessons learned, all those relationships, right, and we take that information and apply it in the curriculum in the way we deliver the information. In closing, if you're passionate about medical health physics, if you're passionate about radiation safety, and you want to make a difference and make it clinical, right, I hope you accept the challenge to be engaged with RTU as we accept the challenge to get this information out to you that you can use to make these practices more safe, more efficient. Basically, what is it going to do? It's going to save cancer patients' lives. It's going to minimize the errors that are out you. To learn more, visit the website or give us a phone call. Thank you.